Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. Give us a call, talk to Dr. Darrow, and get your free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And right now we're speaking with Thomas in Redlands.
Hey, Thomas, Dr. Marc Darrow. Give me just a moment here to introduce the second half of the show. The work that I do is called regenerative medicine. We use platelets from the blood, and we use stem cells from the bone marrow to heal the body, to regenerate tissue. So it works from the top of the head with headaches, down the neck, back, hips, shoulders, elbows, wrists, fingers, and on down to the hips and the knees and muscle tears, and get a lot of hamstring tears, believe it or not, and ankles, toes, feet, plantar fasciitis. You mentioned that you've got foot pain, and sometimes people think they have a neuropathy or a Morton's neuroma, which is not something that is really a neurological issue. And I don't know if you're like that or not. I won't know unless you want to come in to the office, and the number there, if you want to call in to the office, is 800-300-9300. That's 800-300-9300. You can come on in. I have to touch the area to see what's going on. If someone has told you you have Morton's neuroma, then that's something I usually can fix. I think it's typically not a Morton's neuroma, but more of what we call a metatarsalgia, and those are the bones on the bottom of the feet that can get bumped around, and the tissue can thin out a little bit sometimes. And those are things that I can usually heal using platelets or platelets and stem cells. So I would have to touch the area where you're saying you have a neuropathy and see what's going on, Thomas, and see if I can help you or not. On the radio, I can't tell you anything. I'm not psychic yet. I have a crystal ball, but like I tell everybody, it doesn't work.
I thought you broke it.
No, I haven't.
Oh, okay.
So anything else you want to add to that, Thomas? Any other information, any other part of your body that bothers you?
Well, most of my body bothers me.
Oh, no.
No, I'm being facetious. What's scary to me, I'm semi-retired. I'm driving for Uber part-time, delivering some of their food items. Last week, I walked up, stepped up over a curb, and totally lost it. My feet just went out from under. I lost it totally, and I crashed down.
I'm sorry to hear that, but there could be other things beside a neuropathy causing that, and I would have to, like I say,
Great.
I have to examine you. So we got other people waiting,
Okay.
Thomas, and I appreciate your call so much. God bless you, and thank you, and good luck with your healing.
Okay, we're going to Charles in Los Angeles.
Charles, your left knee bothers you. How are you today?
How's everything with you guys there? Hopefully everything is well. Doc, so I want to touch base kind of quick. I've had 2 surgeries on my left knee. The first one was for a meniscus tear, which was fixed and repaired. And the second one was a microfracture. That came a couple of years after the meniscus surgery. I had a microfracture, I guess, on my knee, and they went in, tried to repair it. I'm trying to say try to repair it. Let's just say they did repair it. The point is, Doc, that I've had issues. I've always had issues after the surgeries. I still have, the main issue is that I go on spurts for about 2 to 3 months where my knee it is unbelievably, it just hurts.
Oh, I'm so sorry to hear that. It's terrible.
Yes, the part where it aches the most is, if you can imagine my left knee, it would probably center to the right.
Okay.
That's where I have the little issue that
So the middle part of the knee, where the knees would touch together if you're laying in bed.
So yeah, we're looking at the middle knee. It's going to be a little bit, say, towards the right side of the knee.
Yeah. So let me explain something. The middle, in medical terms, middle we use the term medial, and the outside of the knee is called lateral. And in that medial area, you have the meniscus between the bones. And I could touch that and look with the ultrasound, and I could tell you what's going on there. There's also the medial collateral ligament there. And it sounds like from your surgeries, when you say they repaired the meniscus, they probably took out part of it. That's typically what happens. Back in the day, they used to, when someone injured their knee, they just take out the whole meniscus. They just gutted the knee. You know, you see these giant scars.
The only thing I can tell you regarding the meniscus was that they did. It wasn't a complete tear. The only thing that I can tell you what the doctor told me was what they had to do was to shave it down.
Right. So you have less tissue there than you had before, which creates instability in that knee. So my job, if you came to see me, would be to grow back some of that tissue using your own body cells. It's called regenerative medicine. And probably in your case, I would want to jump straight to stem cells mixed with platelets because it's a stronger healing modality than just using platelets. It sounds like you got a lot of work to do on that knee. I'm sorry, Charles. I'm sorry you had those two surgeries. I'm not sure you needed either of them. And that's just the way it goes. It's water under the dam at this point. You got what you got, and we got to take you as you stand.
Like you said, there's not much you can do about it now, so the only thing I can do is just look forward. The only thing is I really don't want to go in and see somebody and say, well, you need a third surgery. The thing is now I'm a pretty active person. I've always been an active person my whole life, and this has literally kind of shut me down completely because if I start running, my knee aches, and I suffer. The other thing I'm also suffering from is my hamstring aches. Really bad too.
Okay.
I get feels like I get.
Well, I'd have to check you out. Look with my ultrasound. Look inside, see what's going on. But there's good hope. Most people get better with regenerative medicine. Not everybody. The reasons people fail is typically because they refuse to follow my directions, and so we get athletes that come in every day. And we inject them, and then they come back in a couple of weeks, and they go, it still hurts. And I go, yeah, you didn't stop working out. You got to let the area heal. Pretend you had surgery. The nice thing about this, you walk in the office, you get an injection, and walk out. It's not like surgery where you're laid up or have risks of infection and body parts being removed and all that. This is pretty simple. It's just injections. So I think there's good hope for you, Charles. I can't tell you a thing really until I inspect the area and examine it, move you and touch it. But most people get better. The other reason people don't get better is they refuse to do more than one treatment. They think, I don't know where they make it up from, they think that if they get stem cells, it's the panacea for life, and they're going to live till 1 million years old, and their whole body is going to feel good. And it doesn't work like that. Stem cells and platelets are just...
I just want a couple more. I don't want to marry. That's too much for me. But definitely, right. I'll try to set up an appointment and see if I can come and see you. All
right, man. God bless you, Charles. Looking forward to seeing you. And the phone number to the office for those of you that want to call in, the office number is 800-300-9300. I'll repeat it, 800-300-9300. You can also get a hold of me through my website and watch tons of videos of me doing these procedures. The website is lastemcells.com. That's www.lastemcells.com. You can also email me from any page there. So, Nita, anything before we go to David?
I just want to give the phone number again, 866-870-5752. I have lines open for you right now, and we have David in North Hollywood.
David, stick with me 1 second. This is Dr. Marc Darrow. I'm going to just talk about two things quick. We use the same cells on the face to regrow the collagen in the face and make people look a lot younger like they used to. And we can also stimulate hair follicles on the head. And in my book, Stem Cell and Platelet Therapy, which you're going to get for free for calling in, David, there's a chapter on both of those. So, David, your lower leg hurts. Which leg?
My right leg.
Okay, which part of it hurts?
It's been diagnosed with venous stasis.
Ah, okay. I don't deal with that at all.
You don't do it.
I know about it, but I don't fix it.
Okay.
It's not a musculoskeletal issue. It's it's a circulatory issue. Do you have varicose veins also?
I don't have neuropathy. I can walk for miles. It doesn't hurt me. It looks awful.
Okay. Well, the looking awful is something you have to go to a surgeon, probably, who can remove that vein. And that's not something I do.
Well, I have gone to a vein specialist in Encino, and they've done the procedure where they go in with the foam and they open up the vein.
Yep.
And like I say, I don't have any pain, but it's and I've been told there's nothing you can do about the visual. It looks that way. Nothing you can do about it. There are some laser treatments that can possibly change the color of it a little bit, but
okay. Well, thank God it's cosmetic. Thank God it's cosmetic, David. Because if you're in misery, if it's just cosmetic, that's
for venous stasis.
There might be, but it's not something I do. There may be guys who inject stem cells IV or into that vein or something, but it's not something I do.
About your special diet that you have, I'm very interested in that.
It's not special. It's been around since the beginning of time. When people didn't have processed foods, they were on a ketogenic diet or a Paleolithic diet. That's just the way it was. There wasn't much food around, and they ran after the food and killed it or dug it up. That's all there was. Today, we're all big and fat, and we have diabetes and heart disease because of the food we eat, which is carbohydrates. So rich people get these bad diseases.
Can I make an appointment to get the diet from you at your office?
No, you don't need to. It's simple. Just write this down. Protein, vegetables, and water. End of story.
Right. Good. Okay. All right. There's nothing special about it. All right.
No,
all right. Thank you.
It's easy.
Much.
God bless you, David. I appreciate your call.
Thank you, David. Our number is 866-870-5752, right here in the studio. Speak with Dr. Darrow. I have lines open for you, and you also get the free book today. Dr. Darrow's latest, it's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. Do you want to go with a question while we wait for the callers to rack up?
Yeah. So this one that came in last Saturday. It says, shoulder dislocations. Hi, I just heard you on the radio. Are you able to help someone whose shoulder dislocates? The answer is, yeah, baby, so far. I can't promise anything with the work I do. Regenerating the body is something that, if it's pain, it's easy to gauge. A person comes back in a couple of weeks after they have their injections of platelets or stem cells or both, and they tell me how they feel. Are they better? Are they worse? And we have a gauge. But with dislocations of the shoulder, it's sometimes more complex. Sometimes I have people that come in that have very frequent shoulder dislocations. I had one girl who came in whose shoulder actually dislocated every day of her life, at least once. And that's a very dangerous situation because she can rip out the brachial plexus and lose all the power to her arm and hand. We were able to help her. She hasn't had a shoulder dislocation since. For that type of a situation, I injected the shoulder joint, the labrum, the subdeltoid bursa, all of the rotator cuff tendons and ligaments, and I tightened that thing up. So she's fine. Every shoulder dislocating patient I've had has told me they don't dislocate anymore. Even the people that had surgery first, where it didn't work, where the capsule was tightened up, who have come to me, have gotten better. I don't like the surgery for the shoulder dislocations because what they do is they tighten up the shoulder capsule and decrease the range of motion. So I don't like that. I'd rather just tighten the whole shoulder up using regenerative medicine of platelets and stem cells and thicken up all of the ligaments and tendons around there to hold it back into place. Sometimes a surgery is necessary, and sometimes those surgeries fail. But the answer to the question generically is I've had very good luck with it over the years, and there's no promises. I can't promise anybody anything, and people get very mad at me, and they go, "You're not going to promise me anything?" I go, "No." What are the promises in life? Nita, tell us, what are the promises?
Death and taxes.
Yeah, baby, that's it.
That's all there is.
In medicine, no one should be promising anything. We've got very high percentage of success, much higher from what I've seen than surgeries according to the research, but there's no promise. No doctor should promise anything to anybody. And another question for you?
That's true. It's all true. And if you want to call and talk to Dr. Darrow about any of the above, not death and taxes, though. 866-870-5752. That's 866-870-5752. Right here in the studio. I have lines open for you. Don't be shy.
Nita, do you know I have a master's in taxation?
No way. Really? Oh, I know you like nearly 20 years. I never knew that. That's hilarious.
Yeah. Well, I spent 22 years in college, and one of my degrees beside law and medicine was a master's in business taxation at USC. I did it at night. It took me 3 years while I was practicing law. So, yeah, I can talk about death and taxes. I've seen a lot of both of them.
Well, I stand corrected.
Should I go to another question while we're waiting for callers?
Yes.
Okay, this one says thumb. Let's see what the person says. Pain in right thumb for the past 2 months due to work. So I get tons of patients with thumb pain. It's typically from overuse. Postal workers, my God, they just blow their thumbs out with terrible arthritis, flipping letters all day. Guitar players, musicians, they get all kinds of arthritis in their hands and their thumbs. So we treat all of that. That's very simple to do. We use a teeny little needle, and we can spray the area with an icy solution so it doesn't hurt. And because when you get into the distal areas of the body, that means far from the center of the body, there's a lot of little nerve endings, and it's more sensitive. So the bottom of the feet, the toes, the hands and fingers are more sensitive than central areas of the body. So we can use that spray if you want to come in and get those injected. I use a 30-gauge needle. That's like an acupuncture needle. It's very thin with a small syringe, so I can push it through that small needle. And I treat thumbs and hands almost every day of the week. It's a very, very common thing that people have. Tons of guitar players, my God. They hook their thumb over the top of the neck and they stretch it out. So, yeah, it's something we can help pretty easily. Anything before I go on to another question? Should we go on to John?
Let's go to John.
John, Dr. Marc Darrow, how are you today?
Dr. Darrow. I had a general question, and it's something that in a specific part of the body, but just in general how the stem cells are extracted or how they are obtained. I know that the platelets are from blood and it's centrifuged before injected back, but I wanted to know how the other one, the stem cells, are.
Okay. So let me ask you a question, John. You seem like you're already an intelligent guy who's done some homework, which leads me to think you have some body pain. Do you?
Well, I do. You're just mentioning the thumb. Guitar players. I'm not a guitar player, but I was using the mouse for a long time in the computer, and it does bother me, my thumb joint. So
okay. For you, it's very important.
I messed my left hand up.
Yeah. Is your thumb issue on your right hand or your left hand?
My left, because I was trying to save my right hand by using
that's
my
right.
left.
So here's what I did. I had an overuse syndrome in my right arm. I wrote 2 books back to back. It took me a few years. And I was on the computer any minute I wasn't injecting patients, day and night, weekends, you name it. And my right arm just kind of went dead. It just ached and was dead feeling. So I started using the mouse in my left hand, and I would rub it on my face. I'd rub it under my desk. I would get in different positions, and that's something you might consider doing. There's also different kinds of mouse balls and other things you can use. But we can also like you said, how do we extract the stem cells that I would use on your thumb if we use stem cells? I like to go to what's called the PSIS. Write it down and look it up on Google. It's called the posterior superior iliac spine. It's right above the buttocks, and it's a thick part of the pelvis that you can't miss. I put a needle in there. It takes me about 3 seconds, and then I aspirate out the bone marrow. And then if we want to, we can spin it. Some areas of the body we have to spin it, like the knee. Other areas we don't. We just leave the red cells there. So it just depends on what's going on. Does that answer your question?
Did you say PSIS?
PSIS, posterior superior iliac spine.
Okay.
The ilium is the pelvis. So it's posterior means the back of the pelvis. Superior means the top of the back of it. And it's a lump on the bone that's very thick, and it's very rich in stem cells.
Okay, so there's a number of places that you can actually produce those stem cells from, right?
Well, I don't produce them. The bones, long bones, produce stem cells.
Yeah, but I meant extract from that.
Oh, you could go into any bone and get stem cells, but this is an area that doesn't hurt, and it's plentiful, and it's easy to get, and it's safe. Some doctors use a drill and go into the tibia, the leg bone. That's supposed to hurt like heck, and the quality of the stem cells is not supposed to be as good. Other guys go into the fat and take umbilical stem cells or stem cells around the belly or the butt. I don't like doing that procedure. That was the first way I learned how to get stem cells. It's kind of I'm going to use the word gross procedure. A lot of doctors like to do it because they think it's easier than going into the bone. I don't think it is. I can do it either way, but patients don't like having a 10-inch trocar jammed into their belly like a liposuction. They can get black and blue and sore for weeks. So no, that's not something I do anymore. The procedure I do with bone marrow takes me, after the area is numbed up with some lidocaine, it takes me literally about 15 seconds to do the whole thing. There's nothing to it. We just put a little Band-Aid on it, you walk out.
Oh, that's great. I do think
I've done about 5,000 of those, so I've kind of got it down.
Yeah. Can you do it blindfolded?
You know, I could, because I can do it by feel, but I never would. That would. I mean, I do it by feel, really, but I use my eyes also.
All right. Thank you, Dr. Darrow. That's all I wanted to ask, and you answered my question, so I thank you very much for that. Take care.
All right, man. God bless you. Thank you very much.
Thank you. Okay. I bet you have a question.
Oh, my goodness. Do I ever? Let's see, which one should we go to today? I like this one. Opioids, knees and back.
Oh,
anytime
go for
it's
it.
about anytime it's about opioids, I'm super interested. Okay, let's see what it says. I am on opioids for many years for pain after knees replaced. Whoa.
Wow.
What does that tell you guys? Knee replacements don't work all the time. I'd say they work maybe half the time, and then half the time people come in to see me and they say, "Can you fix it?" And I go, "Well, I can't inject the metal or the plastic. Maybe if it's some of the ligaments around there I can help you with." Be very careful about getting any replacements. I see failures all the time. The thing about being on opioids after the knee replacements, that's bad news. Because once you're on opioids, you upregulate the pain receptors and you have more pain. I know that sounds crazy, but that's the truth. So be very careful not to start opioids. Opioids can be used for a day or two to get you over the hump of an injury.
Oh,
whoa,
my
that came out of
goodness.
nowhere.
Yeah, we're out of time. Wow. Well, thank you, Dr.
Go to the
Darrow.
website. Yeah, go to the website, www.lastemcells.com. You can watch me doing the procedures. You can go to my phone. Call me at the office, 866. No, that's this number. At the office, it's 800-300-9300. God bless you, Nita Valens, and all your staff there. And we love you all.
Thank you.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.